Hello, I'm Jyoti Gupta, nurse in post-anesthesia care unit. I'm giving a report on Mrs. Amrit Mamuji. A 64-year-old woman was admitted in room number 1 and she is a patient of Dr. Chen. She is a post-op day 0 from a modified radical mastectomy of the left breast with lymph node removal performed this morning. She has a history of hypertension and no prior lung issue. Post-surgery, she was placed on PCA morphine, 3 mg loading dose and 2 mg intermittent bolus every 15 minutes as needed. Her initial vitals were stable and respiratory rate 16 beats per minute, SpO2 96% on room air, heart rate 72 beats per minute and BP 122 by 75 mm of Hg. She initially rated her pain at 5 out of 10. Later, she became increasingly drowsy and rated her pain at 8 out of 10 despite acetaminophen, ibuprofen and frequent PCA attempt. At 15:30 hours, she rated her pain as 8 out of 10 and despite frequent use of the PCA. She attempted the PCA 6 times and remained uncomfortable. As per protocol, the PCA bolus was increased to 3 mg. At 1800 hours, she developed opioid-induced respiratory depression and her respiratory rate 6 beats per minute and sedation score 3. PCA was stopped and 40% oxygen was administered and 1 dose of naloxone 0.08 mg IV was given. She improved to respiratory rate 12 beats per minute and SpO2 95% on oxygen. The physician was notified and reassessed her. She is now alert, respiratory rate 16 beats per minute, SpO2 95% on room air and pain is currently 3 out of 10. My recommendation is continue monitoring the respiratory rate, sedation and pain closely. She is now on hydromorphine per orally 2 mg every 4 hours as needed and 1 mg every 2 hours as required for breakthrough pain. Please also monitor her JP drain output and dressing site for increased drainage or sign of infection. Once she is stable enough, she will benefit from assist mobilization as tolerated. Thank you.